Good afternoon, everyone. This is Teleconference Agenda 2020-04. My name is Jason Rogers, and I will be the host of today's call. I would like to call this meeting to order and inform you all that this meeting is being recorded. Should anyone have an objection to being recorded, you may disconnect at this time. This teleconference meeting will be run by the agenda, and all attendees will be placed on mute, so the primary presentation may proceed uninterrupted. All questions during the teleconference should be emailed to ema@co.delaware.in.us so they may be addressed at the end of the meeting. This email was included in the invitation. Please do not place your phones on hold or as hold. The hold messages will play to the group. When and if the conference mute is lifted, please keep all side conversations and background noises to a minimum as it will be audible to the entire group. Should you wish to speak, please state your name and to whom you represent. Welcome. I have some opening remarks from Dr. Donna Wilkins from the Delaware County Health Department.
Hi, Jason. Thanks for having me on. I just have a few remarks. I would just like to see that everybody was following the governor's mandate to stay at home. I see that's not being done here in Delaware County, and that concerns me a lot because I think all of the medical people, both nationally and around here, have said the only way to flatten the curve is for us to social isolate and stay home, to not go out to parks with your kids, not have play dates, not take your kids out to Walmart and play in the toys. We just have to stay home. That's the only way we're going to get this under control. And it hasn't peaked yet. It probably won't peak for 2 or 3 more weeks. I don't want to see more deaths in Delaware County. I want Delaware County to have the lowest death rate of any county in Indiana. That's my goal. And we all have to work together to accomplish this, and that's stay home. Thanks, Jason.
Thank you, Dr. Wilkins. Item number 1. The current number of positive tests here in Delaware County is now at 9. There was an error in reporting at the state level yesterday, which included a case from outside of Delaware County at IU Health BMH. That has been corrected on the report mapping, and the correct number with 2 additional positive tests today is at 9, with multiple healthcare organizations having tests sent out to labs for pending results still yet today. Item number 2, on March 25th, 2020, the Emergency Operations Center placed a call out to its business and industry partners requesting personal protective equipment, or PPE, specifically masks, gloves, and gowns. In less than 48 hours, the EOC has received huge donations of PPE supplies. These supplies have come in from local factories, contractors, dentists, doctors, painters, restaurants, breweries, businesses, and individuals alike. In an effort not to miss anyone, we will withhold the names of each donor until such time that we have a complete list. Today, these supplies were distributed to all public safety agencies within Delaware County. As the supplies continue to come in, we will get them out to agencies as requested, as the requests come into the EOC. Over 4,200 masks, 100 isolation gowns, and 6,000 pairs of gloves, all donated by local business for first responders, were delivered today. There is no stockpile for public safety to draw from, and all vendors are reporting back orders. I want to take a moment to say thank you to the community for coming together on this. Item number 3. I currently have a call from the state EOC that occurred yesterday. It was very informative, and I have an audio clip that we're going to share from that call from the State Department of Health.
Next up, from the Indiana State Department of Health, we're going to turn to Caitlin Watson.
We are still operating a call center 24 hours a day, 7 days a week, utilizing 25 ISDH employees and also Maximus services to help with that call load. We do have a provider line and a public line that has been streamlined into one phone number, and I think this is a good opportunity to get that out to you guys. That phone number is going to be 1-877-826-0011. And that is both for the public and provider. There's option 1 and 2 there. Again, that number is 1-877-826-0011. And you can direct any questions that you're getting from local counterparts, long-term care and stuff to that number. Logistics today, we are running our second distribution from the SNS, the Strategic National Stockpile. As of 2:37 today, all hospitals and health departments that have designated a red, black, or orange, yellow status in EMR resource were delivered to. Those went to local health departments and hospitals, and we are hoping that they will utilize the masks and gloves that they received to reach out to their long-term care facilities that are in extreme shortage right now.
Thank you. Item number 4, the survey for healthcare organizations, extended care facilities, ESFs, doctor's offices, and urgent care, or UCFs, was emailed out on Tuesday requesting them to evaluate their 30-day needs of PPE. The EOC has received 19 agency needs assessments, and we continue to collect this data. It's important to reiterate that the Delaware County EOC has not been given any supplies for these healthcare providers. We are collecting this information preemptively so that when and if it is requested, we will have it ready to go. Again, we have nothing to distribute now and do not know when and if those requests will be able to be filled. Item number 5, I have a report from our pod manager, Jeff Lacey.
I'm Jeff Lacey, and I'm doing the coordination for all the points of distribution, otherwise known as the pods for EMA. The pod distribution has been going extremely well. We did Delta last Saturday, and we serviced about 450, 460 cars. Yesterday, we went to the Muncie Mall. Second Harvest has done a fantastic job. John Arise's group with COAD, the volunteer organization, has done fantastic. Without them, this wouldn't be possible. They serviced about 650, 670 cars yesterday. Saturday, April 4th, from 10 to noon, we will be at Progress Rail doing a tailgate for Second Harvest again. We anticipate another 600 cars or so. So it seems to be going really well. Ideally, we're going to go back to the north side, probably at Ball State. They have set up a prepared site for us to set up just north of the Worthen Arena. So as soon as we get a date, we'll let you know. And that is currently all the information that I have.
Thank you, Jeff. Item number 6 comes from Open Door. Open Door Health Services has performed 14 COVID-19 tests to date. All have returned as negative. One test was done late last week and sent for analysis, and the patient presented at IUBMH prior to the results being returned. The individual tested at the hospital and was found to be positive and is currently hospitalized at BMH. Open Door testing options are in our Indiana systems 3 to 4 days return, and Open Door has to drive those kits to Indianapolis. Also, LabCorp is another option that they currently have a 7-day backlog on their test. And IU Health has a test within 21-hour turnaround, but it is not accessible to the Open Door patients without a hospital admission or an ER visit. Open Door continues to see medical, dental, and behavioral health patients, although they are trying to direct as many as possible through telehealth. The WIC and family planning services are still available. All counseling is done via telehealth communications, and that comes from Brian Ayers, the CEO. Thank you for submitting that, Brian. Item 7. The www.dcema.com coronavirus hub now has a public safety portal for FEMA paperwork, which is following the National Incident Management System. We are transitioning to the Incident Command System forms to make official requests to our state and federal partners. Those of you in public safety that get this information, this goes back to your NIMS training, and that paperwork will be required. Item number 8. With tents being installed outdoors as temporary medical stations, the National Weather Service still wants to support those efforts. You can keep a real-time information report from the National Weather Service by going to weather.gov/ind/event support. That's weather.gov/ind/event support, and they will give you a specific weather report for your location as long as you have outdoor operations that are ongoing. We are expecting some severe weather into the weekend. Item 9. If you are not getting the Nixle alerts from the Emergency Operations Center, please text the letters DCEMA to 888-777. You may also text any zip code to 888-777 for those area alerts. Please pass this along to your staff, family, and friends, as all press releases are being forwarded to the system for distribution. We now have time for some Q&A. When the conference mute is lifted, please keep all side conversations to a whisper and background noise to a minimum. It will be audible to the entire group. Should you wish to speak, please state your name and organization you represent. Please do not place your phone on hold, as a hold message will play to the entire group. I will now open it up and unmute the group for questions. I have a question submitted to the email from Steve Lindell. The 1-800 number is for both public and medical providers from the State Board of Health to answer COVID-19 questions. That number again is 1-877-826-0011. I have another question. Can I repeat the PPE statistics? Yeah, the information that was given out, or I'm sorry, the information on the PPE that was given out, I will just go over the numbers. It is 4,200, over 4,200 masks, 100 isolation gowns, and 6,000 pairs of gloves that were donated and passed out to public safety agencies. We are still collecting that, as we do not know when or if the FEMA strategic national stockpile will come our way anytime soon. So yes, we are still collecting any donations, and that portal is still open to make donations. Okay, I'll give you one last chance. Anyone have any questions or for discussion? Okay, the call has been muted for closure. Thank you for joining the conference call today. The next update will be announced via email. We're assuming it will be Monday afternoon, as we continue to do these Monday, Wednesday, and Friday. So please watch for your email for the next agenda, or I'm sorry, for this agenda and the next call. Thank you for joining us.